I watched the documentary film How to Survive a Plague last week, and I was inspired to tell a different story than I had planned tonight, even though the other story is a lot funnier. But if you want to watch that, you can watch it on YouTube on our channel, The Dallas Way. So at that, I'm going to go on your own to do that. So I'm going to tell you my recollections of how Dallas and I survived a plague. What I'm talking about, of course, is AIDS. And I know many of you are thinking that the AIDS crisis is over and why should you have to listen to this. But I'm here to tell you that AIDS has certainly changed, but it's not over. My story begins in 1978, and most of you weren't born then. Coming out at Texas A&M was not a possibility. My first visit to a gay bar was on my 21st birthday, and we drove to Houston. I have to tell you that I was so filled with fear that I sat in that car all night long while my friends were having fun inside. Needless to say, I eventually overcame that fear and dove headfirst into the Houston nightlife after I graduated from college in 1981. I loved to dance, and I went out every weekend. Thursday, Friday, and Saturday nights in Houston were filled with such excitement. The dance floor was filled with the most beautiful, shirtless men that sated many of my fantasies and sparked a few more. I admit to a fair amount of hedonism, but mostly I was a self-proclaimed disco bunny. This was long before the term twink came into use, but yeah, I was one of those. Back then, cruising was quite simple. People flagged their interests by wearing colored bandanas, the hanky code. The code was simple, yet extensive. A bandana in your left pocket signified you were a top, in your right pocket you were a bottom. The color of the bandana indicated your sexual desire. Predominantly, you saw turquoise or navy blue, reds, grays, blacks, with an occasional yellow or orange thrown in. Now, there's more than 39 different color bandanas today, even though it's used very rarely. But even then, there were at least 16 or 17 of them, so you kind of had to pay attention. Turquoise or robin's egg blue meant oral sex. Navy was for fucking. Red was for fist fucking. Gray and black were for various degrees of S&M. Yellow signified water sports, and orange meant anything goes. You could get a code sheet at most any store that sold bandanas, and you could buy a bandana at most any store. Anyway, and some men flagged multiple bandanas. They'd have them neatly folded and stacked up in their pockets. For me, the code was simple. Red, black, and yellow were scary, so stay away. Within a year, rumors began to spread about a gay cancer. My friends and I thought that those at risk were clearly identified by those three colors, and we avoided them and the heavy drug users. And as naive as that was, that's how I based my sexual choices. Besides, I like to dance. I'd rather dance than have sex, so that probably helped me for a while. And I felt that I could avoid gay cancer by avoiding those three colors. Fast forward, and I found myself living in Dallas in the mid-'80s, and I'd matured into volunteering for the Dallas Gay Alliance, the DGA. The gay cancer now had a name, AIDS. There was still very little information, but we knew people were dying in New York and San Francisco. We knew it was a blood disease and that it could be spread through sex, but that was all we knew, and we knew it would come to Dallas. Bill Nelson, who you've heard referenced a couple of times tonight, and Mike Richards from the Dallas Gay Alliance, along with Howie Dare of the Oaklawn Counseling Center, were among the first to sound the alarm in Dallas, and they began education programs. Still nobody had AIDS. But we didn't know anybody that was sick, or so we thought. Bill was president of the DGA, and he helped transform it from a purely political endorsing candidate organization into one that explored health issues, social issues, and other needs of the gay and lesbian community. The DGA started the AIDS Resource Center, at first just to educate the community. We warned people about AIDS and how to practice safer sex. We had hot, healthy, and horny sex workshops where we taught men about how to use a condom. We taught them how to have a more intimate relationship with their partners without exchanging body fluids. It was really that simple back then, or that basic. But, you know, before that, gay men didn't even conceive of using a condom. And at first we advocated that people not get tested, nor that they donate blood. If you found out that you were HIV positive, or if a test or donating blood, you found out you were HIV positive, you could be denied health insurance and certainly life insurance. You could also be fired from your job, especially if involved working in the food or healthcare industries. There was still no treatment. It was only a death sentence. So that's why we advocated ignorance was better at the time. One day, Bill found out about a sick man who was living in seclusion. He had lost his insurance. He'd sold all of his possessions. Also, he could pay for his doctor visits. He was dying. He had no food. He had no furniture. He was living on a cot, literally, in a house, dying. After bringing him food, clothes, and furniture, Bill bought bags of groceries and displayed them in the window of his store, the Crossroads Market, which is in the center of the gay strip on Cedar Springs. And he announced that the Dallas Gay Alliance and the AIDS Resource Center now had a food bank. Soon many people started getting sick. In 1985, the Dallas County Health Department reported that there were 125 AIDS cases and 123 deaths. I remember one board meeting in the Dallas Gay Alliance when Bill said that half the members of the board would probably die of AIDS. He was right. Within 6 years, we lost 6 of the men who were in that room. That's more than half. We formed a group, the Gay Urban Truth Squad, or GUTS, that protested in Dallas while DGA board members met with city and county leaders wearing suits. This is about the time that ACT UP had begun in New York City. One of our early demonstrations was when the city of Dallas spent $500,000 to fill a vacant construction hole that a bankrupt developer had left behind. We erected 500 crosses on that field, one for each of the deaths in Dallas to date. The city had spent no money on AIDS. The AIDS Resource Center was educating people, meeting with school groups. We now had a food bank, and we secured one of the first grants for AIDS in Dallas from the Robert Wood Johnson Foundation. With that money, we hired our first fundraiser. We also hired a volunteer coordinator and a part-time food bank coordinator. Later, we received a generous grant from the Meadows Foundation, and we expanded the food bank. The Texas Gay Rodeo Association bought our first walk-in cooler. We can now offer more than just canned goods to our clients. And I remember well when the code inspector came to review the construction, and that would allow us to open up our new doors for the food bank, and he said he had to shut us down because we didn't have the proper requirements for a food bank. William Wayburn, who was now the president of the Dallas Gay Alliance, asked the inspector if he would just wait 10 minutes while he can get Channel 8 down there, and the inspector could explain on camera why the city of Dallas was shutting down the only agency in Dallas that was providing food for persons living with AIDS. And I remember looking at that inspector, and his face just ghosted white, and he paused and he said, "Well, if it were a food pantry, I could approve you." The nuance of words in a bureaucracy is so important. So we opened our doors. By 1987, the first drug, AZT, had been approved for AIDS treatment. It was expensive, it required monitoring, but through the concerted efforts of ACT UP New York, the manufacturer made this drug available cheaply, if not free, to public hospitals like Parkland in Dallas. But Parkland did not want to become the AIDS hospital, and that's a quote. So despite getting free drugs, they capped the number of patients to receive AZT at 42. I'll remind you that there were already 500 deaths in Dallas County. So there was a waiting list. After the 7th person died on the waiting list, in 1998, the Dallas Gay Alliance sued Parkland Hospital with the help of our friend Don Mason, who you just heard. And around that time, GUTS chalked body outlines across City Hall, one for each of the AIDS deaths in Dallas. The AIDS Resource Center was also beginning to collect clothes from peoples whose bodies had become so emaciated from the disease that their clothes no longer fit. So they would come in, they would exchange clothes for a size that would fit. But the deaths kept climbing and the clothes kept coming, and soon we had 2 offices that were filled to the rooftops with clothes. So Guts took the clothes, they sewed them together, they stuffed them with newspapers, and they rented a large U-Haul truck and filled it with effigies. And we drove to the Dallas County Commissioner's Court, and at morning rush hour, we opened the back door, we shoved out the bodies onto the street, and we left. The Dallas County Commissioner's Court oversaw Parkland Hospital. By this time, another promising treatment came to light called pentamidine, which you saw Penny Pickle talk about in her video. And this was the beginning of an underground clinic at the AIDS Resource Center. One of our former board members, Terry Thibodeau, was going blind due to a viral infection in his eyes. The nearest treatment he could find was in Houston. So his partner drove him to Houston every Monday so he can get treatment there. Treatment at the time was getting an injection in your eyeball. The DGA advised people simply to move elsewhere if you wanted treatment. There was none available here. Terry died later that year. So we decided to open a medical and research clinic here in Dallas, the Nelson Thibodeau Community Clinic for AIDS Research. It's named after Bill Nelson and his partner Terry Thibodeau. We were able to obtain research grants, and through that we eventually hired a full-time doctor and a nurse. And in 1989, the day the clinic was supposed to open, we had a fire at 5 a.m. in the morning that completely destroyed the community center on Cedar Springs. The only thing that survived was the food pantry. The fire, it turned out, was arson to cover the theft of our computers. We had an outpouring of support that morning, including a new space, desks, telephones, and we were operational by 11 o'clock. And we opened the Nelson Thibodeau Clinic to the public, and it still operates today on Cedar Springs. The arsonist was eventually caught, and he was sent to prison. It turned out he was one of our volunteers. After a year in court and the pressure brought on by Guts, Parkland changed their ways, and the judge declared the case moot. Doesn't mean we won, but because they changed their policies, we did win, and we declared it a win. So I'm proud to say that Parkland became one of the best hospitals in Dallas for AIDS treatment, and it remains so today. By 1990, I was the president of the Dallas Gay Alliance. The staff of the AIDS Resource Center had increased. We hired an executive director, and we launched a capital campaign to raise funds to buy a building to house all of our programs that were scattered among many storefronts on Cedar Springs. Our staff had been time sharing their desks in the small offices that we were leasing. We bought the building that the Resource Center of Dallas is now located in, and now they've outgrown, and they're raising money to build a new building. When I left Dallas in 1994 for a new job at the Holocaust Museum in Washington, D.C., the AIDS Resource Center had grown to a staff of 24 and a budget of $2.5 million. In D.C., the next year, I learned that I was positive. The following year, a sea change in AIDS treatment happened with the 3-drug combination, which is known as the cocktail, and it's still used today. My medicine costs me about $6,000 a year out of pocket, but I'm still here.